the bottom line here is the cost of healthcare in this country is killing folks. It is such a brutal, punitive burden on everyone. And that's for citizens in all of our states, folks who are having trouble paying the rent or they're having trouble paying for groceries. They can't even dream about owning a house. And when I was visiting with some employers in Vermont this week, they told me that the cost of a family plan for an employee is $40,000. That's $20 an hour, all right? And the biggest driver in healthcare costs are pharma costs, prescription drugs. And whether you want to call it abuse or gaming, the fact is people can't afford it and it is not sustainable. And the reality, too, is that pharma's got a pretty sweet deal. It's got a guaranteed market with the Medicare, with Medicaid, with the VA. It's got employer-sponsored health care, and our employers in Vermont and around the country, they really care about having good health care for their employees. That's important to them. And then they've got the taxpayer-funded research, which is often the hardest, most risky research that the NIH does, that elemental research, as opposed to about marketing and what devices and how to package it. And then, of course, you've got the patent system that we're talking about today, where there needs to be reform, and there's been a lot of bipartisan effort here on this committee to do it. Let me just ask a few questions. Dr. Feldman, let's talk about Ozempic. Yeah, am I pronouncing that right?
Yes.
Yeah, what I understand is that you have done research a lot on this particular drug. And as we know, it costs $936 a month in the US, only $147 in Canada, and $83 in France. That's a huge expense for our employers and for our taxpayers. And last year, Novo Nordisk made $13.9 billion in sales from Ozempic, 60% coming from the US. So we're just paying an enormous amount. But on the patents, and you have researched this, I understand, there's 25 patents and only 4 are for an active ingredient. Can you just explain what that means?
Yes, that's exactly right. So over the years, Novo Nordisk has obtained enlisted in the Orange Book 25 patents on this drug.
And how many for the active ingredients?
And so 21 are on the delivery device. On the delivery device, the injector pen technology that is used for patients to self-administer the medication. The other 4 patents are non-device patents, 2 on the active ingredients and then 2 on methods of use or formulations. And so I think it's a perfect illustration of the problem. You have 25 patents, 21 on these delivery devices. The FTC has said these patents should never have been listed in the Orange Book in the first place. And you know, the brand name firms already are suing for infringement. They're litigating these patents.
Right. Okay, so I have a bill that I introduced with Senator Klobuchar and Senator Braun to streamline the drug patent litigation by limiting the number of terminally disclaimed patents a drug company can assert. In the U.S., the Patent Office, as you mentioned, Professor Rai, instituted a rule. But that legislation that would essentially limit that thicket, can you comment on your view on that legislation and how it would be helpful or not?
Yes, I think it's a great piece of legislation. The idea is that currently the Patent Office is required to reject patents that are obvious follow-ons from other patents, but companies can use these terminal disclaimers, which say, okay, the patent will expire at the same time as other patents.
Right, thank you.
And I think by limiting these litigation on these patents to 1 per family, I think it could promote timely competition.
And Professor Ulrich, you know, I listened carefully to your testimony, and it's the same testimony I've been listening to for over a decade, and that is the sky is falling if we do anything that will interfere with the magic of pharma. But do you know how much the top 15 biggest drug companies reported in revenue in the first quarter of 2024? It was $173 billion. Does that sound about right?
I'm sorry, I don't have that figure in front of me.
Well, it's $173 billion. And Of that, about 14%, 25 billion, was spent on research. By the way, that isn't specified as to whether it's for a new molecule or a combination of an active and ingredient or marketing. Novo brought in 9.5 billion in the first quarter and spent only 1.2 billion on R&D. Do you know how much Novo spent on shareholder dividends and buybacks? Yeah, $4.5 billion. So there is a question here with the advertising expenditures, with the shareholder buybacks and the dividends. Is there room for companies to consider maybe giving the consumers and the taxpayers a fairer price? Professor Wright, a recent study at the University of Texas focused on improving the patent approval process found that if the patent examiners were given more time to examine the secondary patent applications, it could save consumers up to $5 billion. Can you comment on that?
Absolutely. That study was conducted by a PhD scientist and a PhD economist, one of whom is a Duke, and it is an impeccable study. I think that it's bulletproof, and examiners need to be given more time. What that means, however, is that the Patent Office will have to raise fees because it is entirely fee-funded. I think that's a very wise use of the patent agency's fee-setting authority.
Thank you.